RESP 102, Chapter 19. Diuretics. Diuretics. Also known as water pills. This drug lowers extracellular fluid to lower blood pressure or rid the body of excess interstitial fluid. An IV is used for severe or unstable diseases, whereas oral is used for chronic management. It can be used for hypertension, edema associated with CHF, or any patient with fluid retention. Urine output. A normal amount is 30 to 60 milliliters per hour. Polyuria is greater than 60 milliliters per hour. Oliguria is less than 400 milliliters per day. Anuria is less than 50 milliliters per day. Oliguria and anuria are both signs of renal failure. The three nephron functions are filtration, which is to move water and solutes from plasma to the renal tube. Reabsorption, which is to move water and solutes from tubules to plasma. And secretion, which is to move material from one point to another. 5 parts of the nephron are the glomerulus, proximal tubule, loop of Henle, distal tubule, and the collecting duct. Carbonic anhydrase inhibitors. The action site for these drugs is in the proximal tubule. They are a weak diuretic. The common form is Diamox, also known as acetazolamide. It is used to decrease intraocular pressure of glaucoma, correct metabolic alkalosis involving bicarbonate, treat altitude sickness. Osmotic diuretics are filtered at the glomerulus. They are strong and their use leads to increased excretion of water and NaCl. Mannitol is the main drug used, and it is used to manage brain trauma patients with cerebral edema. Other drugs include glycerin, isosauropide and urea. Loop diuretics block reabsorption of NaCl and K in the loop of Henle. They are used most because they are the strongest. They are usually used for hypertension, CHF, acute or chronic renal failure and pulmonary edema. These drugs are furosemide, also known as Lasix, which is the main one used, bometanide, torsemide and ethacrenic acid. The main side effect of these is electrolyte imbalance. Thiazide diuretics block NaCl reabsorption in the distal tubule. They are moderate strength and the first line of therapy for mild hypertension. The most common combo of diuretics is thiazide and loop diuretics. Aquinson, also known as metolazone, is the main drug used. Potassium-sparing diuretics cause increased urination by changing the Na and K exchange in the distal convoluted tubule. They are usually used in combo with thiazide and are commonly used for CHF. Aldactone, also known as spironolactone, is the main drug used. Most adverse diuretic effects are hypovolemia, which is due to decreased fluids, electrolyte abnormalities, dehydration due to much fluid lost too fast, and acid-base abnormalities due to losing too much bicarb. RESP 102, Chapter 22. Drugs affecting circulation. Hypertension. Known as the silent killer because of its asymptomatic patients. Blood pressure greater than or equal to 140/90 is considered hypertension. Primary or essential hypertension is when there is an unknown cause, which is very common. If it affects other organs, it is referred to as cardiovascular disease. If it is left uncontrolled, it can cause stroke, ME, and death. As age increases, so does your blood pressure. Hypertension is more common in males than females and more in blacks. Hypertension in males. Causes are salt intake, alcohol intake, tobacco, no exercise, stress, diet and genetics. Effects are heart stroke, thinner arteries, erectile dysfunction and kidney failure. Hypertension in females. Causes are obesity, pregnancy, menopause, diet, alcohol intake and no exercise. Effects are cardiovascular disease, kidney failure and damaged blood pressure. Secondary hypertension causes include diseases such as Cushing syndrome, hyperthyroidism, kidney disease and hyperparathyroidism, as well as drugs such as amphetamines, corticosteroids, NSAIDs, over-the-counter weight loss, chronic alcohol and high-sodium drugs such as Alka-Seltzer. A hypertensive crisis is having a systolic blood pressure of 180 or more and a diastolic blood pressure of 120 or more. Hypertensive urgency is having a high blood pressure with no signs of acute organ complications but the patient does have a headache, shortness of breath, nosebleed or severe anxiety. Oral drugs are used for this because an IV would drop the blood pressure too fast. Hypertensive emergency is having an increase in blood pressure with acute progressing organ injury. The patient will be admitted to ICU and treated with an IV of labetalol or nitroprusside. Their blood pressure will be monitored invasively with an arterial line. Hypertension drugs. The first line includes thiazide-type diuretics, angiotensin II receptor blockers or ARBs, calcium channel blockers or CCBs, and angiotensin-converting enzyme inhibitors or ACEIs, which are the most common used. Their side effect is a persistent non-productive cough, and less common but very serious is angioedema. The second line includes vasodilators and beta blockers. Angina, which is chest pain, is a marker for myocardial ischemia, which is decreased blood flow and O2. Someone with angina may experience pressure on their chest, a burning sensation and shortness of breath. It usually occurs over the sternum, left shoulder and lower jaw. It can be triggered by exercise and cold weather. Two angina drugs include nitroglycerin, which is mainly given sublingual. It is used for acute treatment of prophylaxis and acute MI. It can be given through oral, IV, transdermal and sublingual. It has a 6-month expiration after opening. And its reactions include tachycardia, palpitations, dizziness and headache. And there is ranolazine, which is used to treat chronic angina. Its reactions are constipation, palpitations, dizziness and headache. Antithrombotic drugs help prevent and break up blood clots in thrombosis or embolisms. They have 3 categories, which are anticoagulants, antiplatelets and thrombolytics. Anticoagulants prevent blood clot formation. The main drugs include heparin, which is in the drug Lovenox, is usually used for thromboembolisms. And the oral drugs include Coumadin, which is used for prophylaxis, thrombosis and pulmonary embolism, and Xarelto. Antiplatelets stop blood from sticking together and clotting. Aspirin is used to prevent recurring strokes and for unstable angina. Plavix is used to decrease atherosclerotic events in patients with MI or stroke history. The side effects include hemorrhage, which is the most common, dizziness, abdominal pain, diarrhea and rash. Thrombolytics dissolve clots in blood vessels. They are used to manage pulmonary emboli, stroke and acute ST segment elevation MI, which is the worst kind of heart attack. Their side effects include major such as GI or IC bleeding and minor bleeding such as during a blood draw.